I'm Dr. Avneet. I am not. I'm live. All right, fine. Hi everyone. I'm Dr. Avneet. I'm in charge of neonatology and pediatrics neonat at Apollo Cradle Motinagar. So today, dear parents and friends, what I'm going to give you tips is what I commonly see from the parents who come to my OPD and they have few questions starting from like the newborn period to like infancy. They have few doubts which I'm commonly seeing asking. Okay? So the five things which
Huh. Shall we start? Let me start.
Good morning, everybody. Sorry, there was a technical glitch. So I'll be in charge of neonatology and pediatrics at Apollo Cradle Motinagar. So, dear parents, today's session, which I'll be discussing with you, is mainly to give you few tips. These tips are based on my experience, which the parents usually ask me during my outpatient practice. The commonest doubts or the repeated questions which are asked or discussed by the parents with me. So let me take up with the first tip. So the commonest question which is asked by the newborns or the early infancy parents is regarding the colic. And one of the commonest thing which most of the parents who are troubled by the colic of their babies is the use of gripe water. So doctor, my baby is extremely colicky. My baby is extremely cranky, especially at the night times. So doctor, my parents are suggesting that we should start giving gripe water to this baby. So as doctor, should we like advise you yes or no about gripe water? So my answer is no gripe water to children. And why? So you all need to know what is the scientific basis behind the gripe water. So gripe water is a herbal medicine which has been used for years together by a lot of parents to treat the colic of their baby. Now, this gripe water, which is a herbal tonic, previously the old preparation of gripe water used to also include alcohol in it. Now lot of companies make these gripe waters. Now parents say that we use this brand gripe water which is like very good, which does not have like contents which are harmful to the child. However, you need to understand that this gripe water, if you go by the contents of it, it has lot of sugars, it has laxatives, it has things which contain sodium bicarbonate, it has, the previous version used to have alcohol, it has laxatives. So what eventually these things do is to calm the baby and even cause little sedation to the baby, so because of which the baby gets relief little from the colic. But it is not something what we want your child to get. So what your child needs relief from colic is lot of your tender love and care. Try to give natural maneuvers to your child, like taking the legs to the tummy of the baby and giving some cyclical movements, like giving little tummy time to your baby, like rocking, walking, and take the child out for a drive. These are the things which are commonly used as a natural maneuvers to relieve the colic of your baby. But gripe water is something which is harmful and should not be given to the children to relieve colic of these babies. So this is my tip number one. That is no use of gripe water in babies who are colicky. Now, let's discuss about the tip number two. The next commonest thing what we discuss with most of the parents is oiling. Okay, so most of the parents want to know that how to oil the baby, when to start oiling for my baby, how, who should do oiling for my baby, which oil to use. Okay, so let's start off with what is the main motive of oiling for your baby. Okay, so what are the advantages of doing oiling for your the baby? So the main motive for doing oiling for your baby is mainly that it helps to mature the skin barrier of your baby. Number one, it helps to soothe and moisturize the skin of your baby. Number three, it helps to do little thermoregulation. So it provides little warmth to your baby, and it helps in a positive nurturing balance between the caregiver and the baby. And also it helps to improve the muscle tone of the baby. Okay. So these are few very, very important benefits of oiling. Yes, we want to start oiling, but some children do not like tolerate the oiling, so they develop rashes and their whole body develops like red macular papular rashes post oiling. So that means the child's skin is not tolerating the oiling. So preferentially we start oiling by 2 to 3 weeks of age. Now, which oil to use? Parents feel कि we should use the सरसों का तेल, we should use like हमने fresh निकलवाया है तेल. Okay, So the recommended oils for children for oiling are the least allergic oils like coconut oil, like mineral oils, and also the guidelines recommend that you can use little massaging with the little Vaseline or Vaseline petroleum jelly, which are least allergic. Okay. The oils which you should avoid are typically the peanut oil, the mustard oil, the essential oils, and the olive oils. Okay. These are the oils which are not made for the skin of the baby. These are found to be have a lot of allergic responses for your baby. So the products which are marketed as herbal, as organic, as natural, those are the products which are least to be used by you, because those are not by the they have not undergone the proper licensing or testing on the skin of the newborn babies. So those are not through a proper pharmaceutical chain. So they are not ones which you should be using. Now, who should be doing the oiling for your baby? So, mother, father, grandparents. These are the ones like who should be doing the oiling. Whereas in Indian society, we have the japas, we have the daimas who do the oiling, and the massaging is done by like very harsh and very taut mechanisms. So the oiling is to be done in a very gentle ways and in a very smooth or a subtle manner, so that the child soothes by getting the oiling done. However, in our society, जितना जोर से जितना पकड़ पकड़ के उसकी टांगे मजबूत होंगी, this is not what is the aim of oiling for your baby. So we want little like subtle, we want the careful and soothing mechanism by doing the oiling for your baby. So what all you should take precautions for the caregiver who is doing oiling for the baby? That is, that person should not have long nails because that can hurt your baby. The person should not be wearing heavy jewelry. Okay. And you should try to maintain a room which is warm for your baby, and it should not be having all thrust of airs and air winds coming inside. Okay. So the aim of oiling is to have like soothing for the baby and mature the skin barriers. The caregiver, which is the parents or the grandparents, should do the oiling, and it should be very comfortable and a calm feeling for the baby rather than making the baby very, very uncomfortable, and avoid oils which are allergenic for your baby. So try to use the coconut oil or the mineral baby oils which are have been tested for the skins and maintains the pH of the baby skin. So I have demusted by the second myth or the second tip for your baby, that is regarding the oiling of your baby. Now let's talk about the third thing for your baby. That is the commonest thing next in lineup comes is that is regarding the food of your baby. Okay. Now I want to give 5 tips here. 5 foods which should be avoided in children who are less than 1 year of age. Okay. So whenever you go to your pediatrician or your doctor, they do give you guide about like, what all foods to be given, how the weaning should be. So here I am not talking about how to introduce weaning for your baby or introduce semi-solids for your baby. So I want to talk about 5 foods which are not to be given for your baby. So first thing, that is in children less than 1 year, cow's milk. Okay. Cow's milk is something which is not nutritionally or nutrient appropriate for your child who is less than 1 year. It leads to iron deficiency and can lead to allergic responses. So it should be avoided for drinking for a child who is less than 1 year of age. Okay, that's my tip number 1 for the food which should be avoided in children less than 1 year of age. My second tip is we should avoid the salt or the sodium is basically for the taste. However, you need to understand that by giving salt to your child, we are putting extra sodium load on a kidney of a child which is still in the developing phase. And we do not want this extra sodium load on the developing kidney of your baby. So parents feel that my child is not eating because the child is not getting salt. But you need to understand that we are putting extra load and hampering their kidneys by putting load on their kidneys. So the salt should be strictly avoided, preferably till 1 year of age and at least till 9 months of age. My third tip regarding the food, that is regarding the sugars. The sugars eventually metabolizes and causes lot of illnesses related to the intestines, and they lead to dental caries and affects the metabolism of your child. So sugars, preferentially, all these sugary foods are very tasty for the child. So all these synthetic sugars, which we commonly find in the baby foods and everything, these are something which we do not recommend for your child, which is unhealthy for your child before 9 months of age. So sugars should be avoided for your children who are less than 9 months to 1 year old child. Now, my fourth tip regarding the food is regarding your nuts. Okay. So nuts have a choking hazard. So we should never give nut to your child directly. Okay. So till 1 year of age, nuts have a choking hazard. Also, some of the guidelines recommend that nuts can have allergic responses. So nuts, most of the guidelines say if used before 9 months of age, if there is no nut allergy in your close family members, then only it should be introduced. Otherwise, you should try to introduce after 9 months of age. We should introduce one allergy food at a time, give it for a week, and then introduce the next allergy food. And the nut should always be used in a powdered or paste form and never as direct nuts to your child, because it can lead to choking hazard. And my fifth, which is a very, very important tip to most of the parents, and we see commonly whenever I guide my parents as 6 months, I would say 50% would have said that we have already given this to our child, and that is honey. All children less than 1 year should never be given honey. So you need to understand that honey contains a toxin which is called as botulinum toxin. So this botulinum toxin is very hazardous and can lead to effect on the intestines of your baby and can cause intestinal paralysis as well. So we should try to avoid this botulinum toxin containing honey. So no honey is pure. Any child less than 1 year of age, irrespective whatever way you have procured her honey, should not be given to your child. So these are my 5 food tips which have to be avoided in child who is less than 1 year of age. Now my fourth tip for you is regarding diarrheas. So most of the children after 4 to 6 months of age, we start seeing parents that my child is having loose motions. So, what is loose motions? And how do we treat loose motions? What you should do, what you should not do at home to treat these loose motions. Okay? So, loose motions, in our technical term, we call it as gastroenteritis. So, how does this gastroenteritis happen? So, gastroenteritis commonly happens because of viral infections. Some percentage can be because of bacterial infection, and very rarely can be because of parasitic infections. Yes, we do see sometimes that the children have taken some medications. We increase their intestinal paralysis and peristalsis and can lead to increased frequency of stools. And also we do see the loose motions can be because of some of these allergies. Okay, but yes, 90% of our loose stools which happen in children are due to viral illnesses. And how does the child procure these viral illnesses? Okay, commonly the parents come to me, yes we know कि बच्चे को लूज मोशंस हो रहे हैं क्योंकि उसको teething हो रही है, but you need to understand that teething can increase slight frequency of the stools but may not be the reason for extreme diarrheas in your child. Okay, so it is the commonest source of these diarrheas in children is poor sanitization, poor hand hygienes, and the use of bottles and poor sterilization of these bottles, or in little bigger children, the use of street foods or outside foods. So these are the commonest causes of the diarrheas in children. So as parents, what you can do at home to help out the child with diarrhea. So first and foremost, for any child with diarrhea, is the hydration, 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 hydration. Okay. So the child is losing water by vomiting, by reduced oral intake, and high purge rate of the diarrheas. Okay. So what we want is good hydration for your baby. Okay. How to do that hydration? I'll guide you in next slide, next step. So the other recommended or proven therapy for diarrheas or acute watery diarrheas is zinc supplementation, for which you can take guidance from your pediatrician. Probiotics are definitely proven to be helpful for children who have diarrheas. And small frequent meetings. Whenever the child has diarrheas, we know the first thing will happen is the child will stop taking orally, the child will start vomiting, and the child is having high purge rate also. So we know they may not be in a state to accept food, but as parent, you should try to give very, very small quantity, whatever the child is easily able to take it. Okay. And if the child is not able to take, again, the dictum will be a hydration. And the fifth step will be proper genital hygiene. Okay. So you should ensure that the baby is not always wrapped up in diapers, because that's when the child is going to get into more rashes. Try to keep the child open on a dry mat or dry sheets so that the child is getting aeration and will not get into severe rashes because of the diarrheas. So now what about the hydration? How you should ensure good hydration for your child? So the good hydration should be ensured with normal water, with coconut water, with buttermilk, with lassi, with like your chach or soups or shikanjis. And the most important is the WHO ORS by Electral or whatever way the WHO ORS is available in the market. Okay. So the hydration is the most important dictum, preferentially with homemade fluids, not with the other. What we want you to avoid is those carbonated drinks like the frizz containing drinks, or the synthetic juices, like you have those fruities or these cold drinks or these sugary drinks which are available in the market. Some parents feel that okay, we can give gripe water to the child. No gripe water, chicken, right? And some feel okay, let's stop any kind of food for the child. Okay, no, stopping food is not the answer. Try to give small quantity food to your child. Okay. And some people also come up with the fact that we give medicines which are going to stop the loose motions, and they take medications from chemists which are available in market to reduce the motility and stop the diarrheas. No, these are not the medications which should be used in children. And there are people who come with taking antibiotic on your own. No, we should not give antibiotics for all diarrheas. Let your pediatrician decide whether your child is a candidate to give any antibiotics, or whether the child is having bacterial diarrhea or it's just a viral diarrhea. So most of the viral diarrheas resolve in 5 to 7 days. So it's the time, and it is the good hydration which is the dictum for treatment of diarrheas. So when you should visit your pediatrician. So if the child is having very, very high purge rate, you feel the child might get into dehydration. If the baby is not at all accepting orally and the child is having recurrent vomitings, if your child is having high grade fevers and the child is not responding to normal antipyretic medications like paracetamol, if the child is having blood in stools, or if the child is reduced oral acceptance and the urine output is very, very less and the child is getting extreme letharginess. Okay. So these are the red flag signs where you should visit your pediatrician, because these indicate that your child is getting into dehydration and may require intravenous IV fluids to get the hydration back for your child. So diarrheas need patient management, vigilant management, and support from your pediatrician as you get into red flag signs, and not every diarrhea is a sign of TB. Now, my fifth tip as a child specialist is also regarding a fact which now we are commonly seeing in our OPD practice, which repeatedly as infants parents or early childhood parents are asking us, is regarding the car sickness. Okay, a lot of parents are coming to us that my child is getting into car sickness. So what is happening, why the children are having, why the children have a lot of car sickness? So what is car sickness? So car sickness is a sensation which your body is feeling, where that sensory symptoms are not being perceived by the eyes and ears of the babies. So that leads to the discrepancy between what the body is sensing and what the eyes and ears are perceiving. Is there is a difference between those things. So because of which, whenever the child sits in the car, the child comes up with symptoms of, abdominal pain. The child gets nauseated. The child starts feeling vomiting, or child gets vomiting, or child starts feeling dizziness, or complains of headache, or complains of irritabilities. So these are the signs which you should look for in a child whenever the child is having any of these symptoms while sitting in the car. So how can you ease out a baby who is having this car sickness? So try to move the car with frequent breaks. Don't carry on driving for a longer period continuously. Okay, try to have little window which is open. Okay, now some people feel that we should not give anything orally by mouth if we are going for a long drive and child has having car sickness. No, you should give snacks, but small snacks to your child who is having car sickness. Do not overfeed the child if you are traveling for a longer duration. Okay, you should carry few vomiting bags, or you should carry some a piece of like tissue papers, or you should have like small dry sheets with you, that you know that your child is notorious to have vomitings or car sickness. And you should have extra pair of clothes for your children, that in case the child gets into vomiting. In market there are few candies or ginger candies which are available for bigger children. You can give them these ginger candies in their mouth while they are traveling. Try to make the child sit if on the back seat, in the middle of the back seat, so that the child is facing at front, or preferentially make the child sit on the front seat, so that the child is not too much having discrepancy between the eyes and ears and what the body is sensing. And also importantly, a lot of parent feels, let's engage the child with the screens and books. No, the screens and the TV screens or the phone screens are going to increase their sensation of nausea and vomitings. And some people, let's read books. No, that is also going to, when they are focusing on the book and the sensation with their body is perceiving, increases their chances of vomitings. And as I told you, heavy meals should be avoided for children, and they should not be empty stomach as well. Okay, so how we can treat, the commonest question is asked, that how we can treat this motion sickness. So you need to understand that there are few medications or chewable medications which are available in the market, which your doctor can prescribe you for this motion sickness, which can be taken up before 15 minutes, 20 minutes before the travel time of your baby. By your pediatrician, for bigger babies, there are some transdermal patches which are difficult to procure in India, but yes, if like in foreign, they are easily available. So those transdermal patches can be put up before travel time for your babies, but should be avoided for children who are less than 1 year of age, because they can give heavy dosage of medication, so it should be avoided for smaller children. So never be angry on your child about the motion sickness, because this is something which is not in hand of your child. This is something which can happen with any a person, adult or children who can have motion sickness. So make them calm, make them ease out if they get motion sickness. We know that a lot of children can get, a lot of persons or children can get into motion sickness. So alleviate their anxiety and relieve them and calm and compose them when they get these symptoms. And gradually with time, they can get over these symptoms also. So I think these were 5 important tips as doctor, which I see from like infancy to little later age, which commonly my parents have been asking regarding this. Yes, there are the talk can be as lengthy as possible, and there are so many topics which can be discussed. But I felt these are 5 important pertinent tips which I wanted to discuss during this session. So I'm really thank you for your patient listening. And if there are any questions, you can put in the chat box. Thank you so much.